Hello, good evening. Welcome to our patient education programme hosted by Hashir International, specialist clinics and research institute for misophonia, tinnitus and hyperacusis. Hashir International is a multidisciplinary organisation which aims to help you with assessment and management of your misophonia, tinnitus or hyperacusis. Each month, we'll be exploring a different topic within sound sensitivity, aiming to give you a broader knowledge and understanding of these conditions. My name is Joanna Barker, and I am your host for these sessions. I've been an audiologist for the last 12 years, and I'm a specialist in misophonia, tinnitus, and hyperacusis. Sound sensitivities are my passion, and I'm really excited to bring these live sessions to you. Today, we are kindly joined by Carly Sygrove, hearing loss coach, hearing advocate, and author. Carly has used her own experience with sudden hearing loss to become a strong advocate for deaf awareness and build a coaching practice that helps others navigate life with hearing loss. Carly has co-authored a book that has been recently published. She writes for other hearing platforms, including Hearing Link, has founded My Hearing Loss Story blog, where she shares her personal journey with sudden hearing loss, and created and manages the website Sudden Hearing Loss Support, the first site dedicated specifically to this condition. In addition, she also co-hosts the Happy Hearing podcast, where they share inspiring stories and the latest in hearing health and technology. In this talk today, Carly is going to share insights from her experience of sudden hearing loss and offers practical strategies and emotional support tools to help individuals navigate hearing and balance challenges. Drawing on her personal expertise and professional expertise, Carly highlights the transformative power of coaching in empowering clients to overcome obstacles, achieve their goals, and improve the quality of life. She's also hopefully going to introduce her new book, Sudden Hearing Loss Stories of Hope, Guidance and Support, which aims to raise awareness of sudden hearing loss, its practical and emotional aspects, the importance of prompt treatment, and provide support, guidance, and hope to those affected. There will be the opportunity to ask questions after the presentation, so please feel free to post these through the chat function. Thank you so much, Carly, for joining us today. I will now hand over to you.
Hi everyone, hi Joanna. Wow, that was a good introduction. Thank you. And thanks for inviting me to speak today. As you said, I'm Carly Sygrove. I'm a hearing loss coach, advocate and writer. And today I'm just going to share a little bit about my experience of sudden hearing loss, share some tips for moving forward from recent hearing loss or sudden hearing loss, and talk a bit about my book as well, and about my work as a hearing loss coach. Okay, so I'm going to share my screen with you all. There we go. Can you see it, Joanna?
I can, it's just loading up now.
Okay.
I'll let you know that. Perfect, that's excellent.
Yeah, you got it? Right.
Yeah.
Okay. Okay. While sitting in school auditorium, listening to a guest speaker giving a presentation, I put my head up from writing some notes, and out of nowhere came a loud, screeching sound that filled my head with pressure. This is how I lost the hearing in my left ear. I didn't feel ill at the time. It's all of a sudden, the sound in my left ear just disappeared. Okay, so this is a picture of Madrid, which is where I was living at the time of my sudden hearing loss. I had been there for about 2 years, and I was working there as a teacher and living there with my partner. When my sudden hearing loss happened, it was the start of a new school year. I was so busy, I was setting my classroom up and I was getting the children in and meeting the new parents, and just really didn't stop to think about my health. So when this happened to me, with the strange spinning and the tinnitus in the auditorium, I didn't actually know that my hearing had been affected. I remember turning to the person to the left of me and asking her a question, and watching her lips move and thinking, strange, I can't really hear what she's saying, but thinking, oh, it's a busy auditorium, it's probably nothing, and just carried on. And it wasn't until a day or two later, when I was on the metro train, the underground train to work, and I was listening to a podcast through my earphones, and a public announcement came on the train, and I took my earphones off to listen to it and then put them back in. And I realised the left earphone wasn't working. So I was playing around with them, and they were cheap earphones, and this was a normal thing that used to happen. And I realised after a while that actually it wasn't the earphone that was working, it was my ear. And I realised I could hear absolutely nothing out of that ear. At this point, I started to worry, but at the same time, I was a busy teacher at the start of a new school year. And I just thought, I'm tired, I'm stressed, a good night's sleep. This is just something that's going to clear up on its own. I'd never heard of sudden hearing loss. This was not on my radar. I'd never had an ear infection, no problems with my ears, absolutely brilliant hearing up to this point. So it was never anything that I even considered. It wasn't until 8 days later that I saw my doctor. And when I saw my doctor, she looked in my ears and she said, everything looks absolutely fine. She said, maybe there's some inflammation that she can't see. So she gave me some ibuprofen, some nasal spray, and said, come back in a week if things are any better. In a week's time, things weren't any better. I was exactly the same. The vertigo, I'd actually had vertigo for the whole of this time, like quite severe at the beginning, to the point I was laying on the floor of my classroom before children used to come into the class. It got so bad. Anyway, at this point, I went back to the doctor. She referred me to an ENT specialist. So 18 days following my sudden hearing loss, I saw an ENT and an audiologist. I had my hearing tested. And at that point, the audiologist looked at me like really kind of, she looked shocked. And the ENT, she just grabbed me by the arm and said, you need to go to the hospital immediately. To which point I was like, what's the hurry? What's the emergency? I've been like this for 18 days. How can this be an emergency? And I did as I was told. I went to the hospital, took my audiogram, my results, and was diagnosed with sudden sensory neural hearing loss when I got to the hospital. I actually stayed in hospital for a week, and that's not normal procedure. I know from talking to many other people since then. I had intravenous corticosteroid treatment, which again is not typical, and lots of other drugs, other anti-inflammatories, antibiotics, antivirals, everything. They threw everything at this. And at the end of the week, I began with intratympanic injections of steroids into my ear. And then sent home with more pills, a tapering dose of pills to continue the treatment. To cut a long story short, nothing happened. I was exactly the same. The hearing levels were the same. And I was basically just left to live my life with single-sided deafness. Okay, so this is a bit about my hearing loss story. So as I've told you, I had my sudden hearing loss in 2016. Since then, I have lived with single-sided deafness, which basically means I cannot identify where any sound is coming from, which can make finding a ringing mobile phone quite a challenge. She usually stops ringing by the time I find it. It can also make me feel a little unsafe in my environment, for example, when crossing the road and that kind of thing, or when I'm out and about and there's a loud noise and I don't know where it's coming from. I have tinnitus. I have 3 types of tinnitus. I have the tinnitus in my deaf ear, which is continuous. I have a tinnitus in my hearing ear, which comes and goes, which sounds like pots and pans being hit. And I have discovered recently that I have tinnitus in my head, which sounds like a radio at times or a TV in another room. The one that I kind of hear most is the one in my deaf ear. I also have hyperacusis, but it's much better now than in the beginning. It was really difficult in the beginning. I struggled to even go outside, but with time, that got a lot better. Since my hearing loss, I've been diagnosed with Meniere's disease, which is an issue with the inner ear liquid, and vestibular migraine, which is a type of migraine which affects balance. So basically, I'm quite dizzy a lot of the time. In 2017, I tried a cross hearing aid to see if it could help me just feel a bit more safe in my surroundings. And the cross hearing aid would take the sound from my deaf side and via Bluetooth send it to an aid in my hearing ear. For me, this didn't really work, unfortunately. It does for some people. So if you get the option to try it. But for me, it didn't work. And my hearing ear actually felt quite overwhelmed with sounds coming into it from the other side as well as its side. And last year in November, I was fitted with a cochlear implant. Now, this is something that I had been researching and reading about and talking to people for 8 years beforehand. I had been asking my ENT, I've moved around Spain, and everywhere I've been asking them, is this a possibility? And it finally happened where my ENT said maybe. And at that point, that was the beginning of my journey, my experience, because as soon as I got the maybe, that was it. I went for it. I knew this is what I wanted. I have talked to a lot of people. I have read all the research papers on this and seen a lot of positive stories. And for me, it was worth the risk. I had nothing to lose in that ear. I could possibly lose hearing in my other ear due to many years. So this was like, it's my ear insurance. So in November, I got this cochlear implant, and in December, I was activated, and it's been 5 months, and I'm super happy. It's amazing having a sense of sound in an ear that's actually felt dead for 8 years. It's like this side of a bell jar has been lifted. And I know in the UK, this generally isn't an option for people with single-sided deafness at the moment. And I say at the moment because I really hope it will become soon, because it was the same in Spain until not long ago. For me, it's the right decision. It's the treatment that was right for me. It's not for everybody, but for me, it's been wonderful. Okay, so I have become a passionate hearing health advocate since losing my hearing, as you can probably tell. I have been supporting people through various ways, and it all started with my blog. So in the beginning, when I was processing the hearing loss and when I just kind of felt left after seeing specialists, and we tried the treatment, I tried the hearing aids, I just struggled. And I struggled practically, just learning how to live without sound on my left side. So where to sit in a restaurant, how to communicate with people when you actually don't have full sound is actually really difficult when you've never had to do it before. And I was struggling emotionally as well. And I'll talk a bit more about that later. So my partner saw this and one day just said to me, why don't you write a blog? And he just said it out of the blue. And I'd never written anything in my life. And I just thought, okay. And I just did that. I set an account up, I started writing, and it was amazing because just in writing my thoughts and my experiences, it just really helped me cope. It was so cathartic. And soon after publishing my first few blogs, I started to hear from people all over the world. I kept getting emails in my inbox every day from people going through sudden hearing loss or their loved ones, people who were just looking for support. So I realized these people are looking for community. Where can I gather all these people, put them in the same space virtually? And that's where the hearing loss support group on Facebook started. So the blog and the group are both called My Hearing Loss Story. And the group is for anyone with hearing loss because we can all learn from each other. It's a place to share stories and offer support and advice. From the group, I created the Sudden Hearing Loss Support website, which was a collaboration with hearing loss organisations, with audiologists, and we have hopefully answered all those initial questions anyone with sudden hearing loss will be looking for in one space. We'll also hope to offer information on support services, on people's stories, charities that can help as well. So instead of searching Google or the internet for anything you can find on sudden hearing loss, which is what I did, and not really coming out with much at all, this is everything in one space. So I hope that this is something that is helping people. It is already, because people have contacted me, but I hope this is something that will continue to grow with people's stories as well. Looking further down to the right, I was lucky enough to share my story with the BBC World Service a few years ago, and I talk quite a bit about my tinnitus, my hyperacusis. I spoke at the House of Commons with the British Tinnitus Association, who are now Tinnitus UK, and I was invited there to represent people with tinnitus to talk about finding a cure for tinnitus. So I actually talked to my group, my Facebook group, and gathered their questions, their comments, and I shared them at that meeting. I've spoken for various conferences, including the British Academy of Audiology. As Joanna said, I am a co-host of the Happy Hearing podcast, and I have just published my new book, Sudden Hearing Loss: Stories of Hope, Guidance and Support, and I'll share a little bit more about that later. Okay, let's talk about the emotional impact of hearing loss. So it can have practical and emotional impacts, can hearing loss. And I think it's important to say that it can vary, can the impact, especially emotional, depending on what kind of person you are. Some people can deal with challenges differently to other people. Maybe your work demands more of you in a hearing capacity, which would affect the way you respond. So there's lots of reasons that you'd have a different impact for you. Something that impacted me, or something that I realized I'd been living with, was hearing loss grief. And this is something that I talk a lot about in my group, and that is a topic that is continuous, and it's something that I feel isn't addressed at all for a lot of patients. So I'm just going to read this. This is an excerpt from a blog quite a long time ago. I felt guilty for feeling sad. I was swallowing down grief in giant gulps, trying to dismiss complex emotions. Then, several months after my sudden hearing loss, I was given some advice from a stranger who I'd briefly connected with online. I was told that, as with any other loss, I would need to grieve my lost sound with the attention it deserved. And this advice proved so important in helping me address the emotional aspects of my situation, and immediately made it feel acceptable for me to feel sad and allow myself to begin the process of grieving. I had periods of feeling angry. I was angry because I felt I could no longer rely on my body. It failed me. I contemplated the fragility of life. I felt sadness, isolation, and exhaustion from missed words in conversations that used to be so easy to follow. I continuously questioned my feelings as to whether they were a justified measure of grief, and then learned to treat myself with more kindness. I found most help through my grief by talking to my boyfriend, who provided unfaltering support, strength, and compassion. I confided in him, explaining my feelings and new hearing sensations. We shared the experience of loss so closely, and we found our own way to deal with these new circumstances together. Now, as I said, it turns out that a lot of people have this hearing loss grief, and I think sometimes it needs to be pointed out to you. I feel like I didn't realize at the time this is what I was experiencing, and it took quite a while for me to realize this is what I was going through. And I think it's not just that grief for your lost hearing, it's not just grieving your lost sound. We all make plans, and those plans, my plans, never took into account the fact that I might not have my full hearing. So whatever those plans were, they're going to be slightly changed because of that. And I think I was grieving that, those what ifs, and that, that life that would have been if this hadn't happened. It's, it's only human to think, oh, I remember when, I enjoyed this festival where I had full hearing, or, and then think about the future and think, well, it's not going to be the same. So there's that grief of that life you didn't really have because of this. Okay, so we'll talk about a little bit more about some of the other emotional impacts of hearing loss. So we've talked about grief and loss. and a little bit about the 5 stages of grief. So for me, I think my main stages were anger and bargaining. I tried lots of different therapies to feel better. I was extremely sad, and I did reach acceptance eventually. Frustration and anger. So it might be that you're angry because you can't understand speech in conversations when you're out and about, so in social situations, that kind of thing, which is really frustrating. But you might also be like me, angry at your body, thinking, my body's let me down. How could it do this? Maybe for me, I was healthy at the time. I was running and exercising, living well. So this is something that maybe you're also angry at. Low self-esteem and confidence. I think particularly in professional settings where maybe you need to rely on your communication skills, or social settings, and you can't rely on them. You can't rely on the fact that you can hear fully. This can lead to you feeling not confident in situations. I remember going out with a big group of people from my work at the time, shortly after my hearing loss, once I was able to get out and about a bit. And I just sat there and I just thought, I can't hear a thing. I couldn't hear anything. I could just hear noise. It was just scrambled voices and noise. And I could just speak to the person who was on my hearing side, and that was it. But that really affected my confidence. I realized that I was just really struggling. I had always, from that point on, struggled in situations like this, and it did have a big knock-on effect on my confidence. And the stress as well of just living without full sound in a world that is for hearing people and struggling to hear all the time can be draining. Anxiety, again, social situations that worry about you're going to miss something or say something inappropriate. Miss the joke. I often miss the joke. I often will ask, but now I'm okay now because I'm confident in asking, like, what did you say? And people know like they'd need to tell me now. But back, the beginning of all this, I'd just laugh along and just not know what was happening. And that all leads to this feeling of isolation, that loneliness, and it can impact your relationships as well, because communication is everything. Communication and hearing is the way we connect. And for me, I'd always lived with full hearing. So this is my way of connecting with the world. It's a big part of my interacting with the world was my hearing. So yeah, this isolation and loneliness that can come with it as well, and it can just have a knock-on effect. And depression, so chronic feelings of frustration and anxiety can lead to just feeling extremely depressed and sad, and the emotional toll can build up over time if you don't do something about it. And I've seen this quite a lot with people who've reached out to me. So I'm here to tell you that there are emotional impacts of hearing loss, and to some extent, I think anyone with hearing loss will be living with them, but however they affect them. But seeking appropriate treatment, maybe it's hearing aids, cochlear implants, maybe it's getting support from your loved ones, or an audiologist or therapist or coach like myself, or maybe a hearing loss association. All of these things can definitely help you to live so much better with hearing loss. So we've just looked at lots of very sad looking pictures. So this is what living well with hearing loss can look like. So let's change take the grief, take the anger, the low confidence, the stress, the anxiety, the loneliness, the depression, and we'll turn it on its head. And this is what can look like. And I like to think that generally my life looks like this. Every now and again I have a lapse, but generally it looks like this. I think in getting to this point in living well with hearing loss, lots of things, like I said, can help. And this became my passion, thinking, how can I help people live well with hearing loss? Now, I connected with a lady called Caroline Norman through my Facebook support group, and she's a psychotherapist. And she reached out to me one day because she had lost her hearing, just like me. She'd had sudden hearing loss, and she reached out for support. And we started chatting online. And then one day she said, have you ever considered coaching, because what you're doing is basically coaching, but for people with hearing loss. And to be absolutely honest, I hadn't really. And coaching, I think, has a bit of a bad rep sometimes, or just misunderstanding, and people don't know what it is. So I had to Google it, I looked into it, I researched it. And coaching generally is about looking at where you are today in your life, and then looking at where you want to be and making that change. And I could relate this directly to hearing loss. All for the years that I've been reached out to people, and people have been communicating with me through my blog and the group, I could relate. I could just see how this would work. I could see how people are a part of their life. They've got a challenge, which is their hearing loss, and they're thinking, how am I going to move forward with this? So this was my next step. So I trained in coaching, got my diploma, set up my hearing loss coaching support service, and now I work as a hearing loss coach, and I help my clients with all of these kind of things. So achieving any kind of goals related to hearing loss or hearing health, or personal, but including their hearing. So I work with a lot of people trying to navigate the workplace. So maybe it's the goal is to explain to their managers about their hearing loss and how it can affect them, but also what kind of accommodations they might need, this kind of thing. I help challenge limiting beliefs, which I'm going to speak about in a minute, which is beliefs around your hearing loss that might be holding you back. Personalized support, so it's just one-on-one at the moment, although I might do some group coaching eventually. And yeah, just helping with communication skills. And it's a lot of questioning from me. It's not easy. I'm not going to tell you what to do because this is your own journey, and this is something that you need to work on personally. But what I do is facilitate that space and help you get to where you want to be. So here are some of the things that I can help you with. So things like navigating feelings of frustration, self-advocacy, exploring your hearing loss identity. This was a big one for me because I had to think, like, who am I with hearing loss? Who is Carly with hearing loss? And for me, this is all about me kind of embracing this advocate in me. For other people, maybe it's just, living every day how they used to with a few accommodations. It really depends. Moving forward after sudden hearing loss and recent hearing losses as well, making the most of audiology appointments. Now, this one comes up quite a lot because people get an audiology appointment and they have all these things buzzing around their heads, all the questions they want to ask and all the things. And then they'll make a call with me and say, I didn't ask this. I'm not sure about this. I don't know about this. And they've realized that actually they haven't remembered to ask all the things they've wanted, or they've got so many unanswered questions. So I've helped quite a few people prepare for an audiology appointment to find out what's important for them to know, what's important for them to tell the audiologist, what kind of situations, if it's for hearing technology, are they going to want to use their hearing technology for? What's their life like? Do they work? Are they at home? Do they do sport? All of these questions, and we come up with a plan so they can go and then present to the audiologist a few succinct points and just ask those questions, share that information. And it's been really helpful. I've had some lovely feedback just from helping people with that confidence when they sit down in an audiology appointment. Me personally, I do the same. I sit there with my list and I make sure if I get a bit nervous or anything, I've got everything written down, and then it's, I'm going to remember to ask everything. So that's a big one. And lots of other things on the list. Building confidence, a lot of confidence, and mainly self-advocacy as well. Okay, so what does hearing loss coaching look like? It looks like this, a big mess on the screen, lots of words everywhere. I'm not really sure where to start. So this is when somebody comes to me, it looks like this. You don't really know what to read first. It's all got, it's scattered. So if we were to be challenging, for example, a limiting belief in the session, the client would tell me what their limiting belief would be. For example, that I can't be successful because my hearing loss will always be a barrier. And I hear this in various ways from people. After hearing that, I'll then help them unpick it. So I'll do lots of questioning. So I'll be questioning them on where they think they got this mindset. You know, what is their understanding of hearing loss maybe before they had hearing loss? What kind of environment were they brought up in? What kind of environment are they working in now, or are they in now? Different challenges that they think that they might have because of their hearing loss. Lots and lots of questions, asking them to imagine if it wasn't a barrier, what would they do? And in asking all these questions and unpicking all of this, it makes it clearer. So that challenge will be clearer for the client, and they can actually start thinking about, right, how can we reframe this? So instead of saying, I'm not going to be successful, I can't, let's turn it around to be, I can. So for example, I can succeed by developing strong communication strategies, advocating for my needs, and using available resources. Now, this is not something a client will say immediately. This will come after a lot of discussion and a lot of talking and thinking. I think a lot of the work of a coaching session happens outside of the coaching session. So we will have our discussion, and my client will go away with some like small next steps, things to work on in between towards whatever goal they're working on, and they'll come back and they'll have thought about what we've talked about, and then we can actually work from there. So I do like to send my clients off with a few next steps of things to work on to make it really goal orientated, which is what coaching's all about. Okay, I've got a couple of testimonials. I'm just going to let you read them. Okay, on to my book. You're getting a bit of everything today. So here is my new book. It's called Sudden Hearing Loss: Stories of Hope, Guidance and Support. Now you'll see I have co-authored this book, and this book has been co-authored by the lady I told you about earlier, Caroline Norman, who first introduced me to coaching. She's a psychotherapist. And Andrea Simonson. Andrea is a US audiologist. She's in America, and Caroline's in the UK. We have never met in real life. We did all of this virtually. And Caroline, like I said, she experienced sudden hearing loss individually. And for Andrea, it was her husband. So she, as an audiologist, found herself supporting her husband through this, and actually found it more difficult than she had anticipated. So we connected because she reached out from reading my blog, I think originally, and just wanted support for her husband. So this is a passion project for all of us. We just saw a need for, like the website I created, just something physical that people can have, that they can have as a resource to look at. It's full of, basically it covers all the whole sudden hearing loss experience. So we have information on tinnitus, information on learning to work towards acceptance. We have information on lots of people's stories. We have over 60 people who shared their stories with us. So it's full of stories as well, which I hope the reader can relate to. I've already heard from a few people who've read the book and said that they could really relate to some of the stories, which is really nice to hear. And so, yeah, it's just packed full of resources, and there's lots of tips and helpful strategies in there as well. Yeah, so this is my passion project all in one space. In the UK, it will be available on July the 1st, and it's already available on Amazon in the US. You can get it with US shipping if you would like. Okay, I'm going to finish by sharing some tips for moving towards acceptance of your hearing loss. Right, so recognize and accept your feelings. So as I said earlier, you might not really be noticing any feelings in particular, or you might have lots of them. It's your experience. So just recognize whatever you're feeling and know that it's okay. These feelings are normal, whatever is normal for you. Talk to others about how you feel. So for me, that was my partner. He supported me so much. And I think because I was away from the UK, away from family, it just meant a lot having him there. And I had some lovely friends, but they didn't share that experience as closely as he did. Engage in activities like meditation. Okay, it's not for everybody. For some people, it really works. Spending time in nature, for me, that's my haven. I love being outside in nature. And hobbies, just to kind of like help you manage that trauma, help you just calm down that nervous system, especially in the early days if you're quite recent after a sudden hearing loss or a new hearing loss. Ask yourself, what would you say to a friend going through this? And think about what that advice would be. So, or another way of doing this is to take yourself out of your own body and look at yourself and think, what would I tell this person? They need some support right now. Remind yourself that these feelings will pass and it is possible to move forward and adapt. And I think with that, things like reading my book, to just read people's stories and see how they've come through this, and maybe following people on social media, reading blogs, this kind of thing can be really helpful because you can actually see, oh, people do get through this. It's okay. It might take a bit of time, but people are living happily. Try journaling, which I really recommend. For me, that was great. But again, some people maybe not, but give it a try. Think about the situations in your past that you thought were impossible and that you made it through. Now, we've all had times in life where things have been difficult, and actually maybe when you're in it, you're not sure how you're actually going to move forward. You've got the skills. If you've gone through that, you've got the skills to go through sudden hearing loss. So think about those times and think that you did it, so you can do this too. Okay, from the above one, so when you've got that advice that you would say to your friend, say it to yourself and really listen. Seek support. So like I said earlier, it could be a family member, it could be a friend, it could be a therapist, it could be a coach, if you need to talk to somebody. And connect with others. So maybe that's a hearing loss support group. Maybe there's an actual in real life one in your area. That would be amazing. Maybe it's online. And I just find that sharing those experiences can really help you not feel isolated in your situation anymore. And you just feel like more supported. And I see that a lot in my hearing loss support group. People are just connecting because of that shared experience. Educate yourself on hearing loss causes and treatments. Sometimes having information can help you feel more confident, maybe having a bit more control of the situation. I think it needs to be mentioned as well. If you had sudden hearing loss, you might find yourself scrolling and scrolling and scrolling and going through every single thing online. I wouldn't recommend that. I did that. Not helpful. So find a resource, read my book, and educate yourself to a certain extent until you feel comfortable with it. Explore various technologies and hearing aids, that kind of thing, and seeing if that would help. I know for me personally, my cochlear implant is definitely helping me just become a bit more confident with communication. Even though it's still early days, I'm just feeling a bit more confident, and hearing technology can do that. Advocate for yourself. Now, this isn't always as easy as it seems. It's easy to say advocate for yourself, go out there and ask what you need. But if you're not naturally somebody who is used to asking for things or feels comfortable, this can actually be really challenging. And this is something I help a lot of people through coaching with, is just knowing firstly what are your needs and what accommodations you need, and then coming up with a plan or a few things you can say to ask for them comfortably and confidently. Now, this can sometimes take time, but work on it because it can really help you accept your hearing loss. And actually, nowadays, if I need to go in a restaurant, ask them to turn the music down, I have no qualms. I just ask, what can this, if they say no, I can go, I can leave, you know, it's not the end of the world. Break challenges into small, manageable steps to set and achieve your goals and celebrate all your victories. So if you're thinking, oh, I've got this, my big challenge is to, you know, a huge arching term, live well with hearing loss. Well, how is that? How are you going to do that? Maybe step one is speak to my family about how I'm feeling. Okay, that's your small chunk. Maybe step two would be talk to my workplace about how I'm feeling. Maybe step three is tell that person at the coffee shop that I can't hear them when they've said my name. You know, these little steps, and celebrate. Every time you do it, celebrate, because if you don't celebrate, who is? And it just keeps you going. I know with my cochlear implant, every single milestone I have celebrated because it just gives you that, you know, that drive to keep going and that drive to just get to where you want to be with it. Be kind to yourself and allow time to adjust. So this is, if you're struggling, particularly for people with sudden hearing loss, this is some advice from Caroline from our book, and it's just take time away from your usual activities if you need, but that daily structure can be really helpful as well. So just keep a little bit of structure there. But if you need to take time away from whatever your daily life is, whether it's working full time or, you know, taking care of children, that kind of thing, see who can help you, ask for help, take a bit of a break if you need it, but keep that structure as much as you can. Maintain a positive mindset by focusing on what you can control. Now, this is a big one because it's natural to focus on what we can't control, what's happened to us, especially when sudden hearing loss is completely, you know, none of us have done this on purpose to ourselves to suddenly lose our hearing. So this is something not being able to control, and this can have a knock-on effect for people. Notice. So having that focus on actually, okay, this has happened, I couldn't control it, but what can I control? And thinking, okay, right, what can I control? A lot. I can control how I act in the situation. I can control whether I ask for what I need. I can control, you know, where I'm going to go on the weekend, where I'm going to, you know, enjoy my social time. You can control all these things. If, for example, people are going to a big restaurant and actually you're thinking, not sure I really want to go there, talk to the person who's arranging it. Say, oh, could we actually go here? It's a bit quieter or it's a bit smaller. You can control so much that will help make things a lot easier. So try and shift that mindset from not what you've not been able to control in the past, but what you can control for the future. 2 little tidbits of encouragement from people in my group. I can't remember when I picked these out. It's a long time ago, but I wrote them on Post-it notes, and I just thought this is such nice advice for somebody going through sudden hearing loss. So you'll find yourself getting better in a life that you once enjoyed, and it won't be the same. There'll be bumps, but somehow you'll make it. And I think that kind of sums it up. Like, life's full of little bumps, and this is just another little bump. I'm going to leave you with 2 questions and a quote. So 2 questions to finish with. What have you got your hearing loss to be thankful for? Now, if you're in the early days of hearing loss, you're probably thinking nothing is awful. That's normal. Yeah, that's how you're feeling. It's how I was feeling when I first lost my hearing. I hated it. But now I'm looking back and I'm thinking there are so many things that I'm thankful for because of my hearing loss. I think firstly is just being more compassionate. I feel like I think more about people's feelings now when I'm talking to them. I consider that other people are dealing with things. And it's not that I wasn't compassionate before, but I think I'm so much more now. I've now got a love of writing because of my hearing loss. I'd never written a thing, and now I actually do it professionally, which I love. I love working with people in my role as my hearing loss coach, and so many things. Oh, being part of this community as well, just being part of the hearing loss community and meeting so many amazing people along the way. Even just talking at something like this, there's no way I would have done this when I was a teacher. I did not have the confidence. So I think, in fact, my hearing loss has actually helped me work on my confidence in general. And the last one came this question: how could your life be even better than before the hearing loss? I'm just going to leave you with that to think about. This came up from a coaching session a while ago, and the client was being very, very negative. And I could just see, though, there was so much positivity there. And I asked him this, and he actually came back the next session and answered the question for me. So if you've got a hearing loss, have a think about the answer to that question. This quote has done so much for me. I love it so much. It's from Carl Jung, he was a Swiss psychiatrist. I'm not what is happening to me. I am what I choose to become. And for me, this means remembering who I am, who essentially I was before my loss. It's the same person I am now, just with a few adjustments. And like I was saying earlier, we have so much choice and we have so much control. And it's our job to decide what we want to do with our future. And that's where I'm going to leave you. Here are some contacts, and I'd welcome any questions.
That's amazing, Carly. Thank you so much. I'll leave that up for just a second and I'll ask you to take the presentation down if that's
Yeah.
okay. Um, I found the section on acceptance really interesting because a lot of our sudden hearing loss patients, there's no reason to why they have a sudden hearing loss. I didn't know whether that was the same for you. There's not often an answer to why these things have happened. Was that your experience, first of all?
Yeah, definitely. So many people with sudden hearing loss have idiopathic, meaning they don't know what the cause is. And the same was for me. Since then, doctors have kind of speculated, oh, I think it's because you had Meniere's disease, but nobody's agreed. So I still don't have that definite answer. And yeah, not having a reason for hearing loss or any kind of health issue
Yeah.
makes you question everything, because it's like I remember questioning the food I'd eaten that day. I remember questioning, I wore my hair differently that day. Like I had like a way that I'd not worn it in years. And I thought, could it be something like it was down to these things? And I'm thinking, laughing at it now, but I went through everything. I got on the bus that morning instead of the metro. Oh, could it have been that? I had all these different things that happened that day that I analysed. I just went, it's like with a fine-tooth comb, I was analysing everything, trying to find a reason. And even now it's like, oh, because I have other health issues, it's like, oh, maybe that contributed, maybe that was the cause, or maybe I still don't know. So there is that difficulty in reaching acceptance when there's no answer and there's no reason. And I think for that is really making peace with the fact that you're probably not going to find out. And
Yeah.
it's hard. And I think as well, because there's no the treatment plan as well. It's not like for many health conditions you'll get given the diagnosis and then so this is your treatment plan. After this, you'll feel better. It often doesn't work like that. I've got exactly the same hearing levels as I did back then, like 8 years ago, 9 years ago. So yeah, it's difficult.
Can I get you to put down the presentation now, Carly? Thank
Yeah.
you. Yeah, but that's what I think is really important about that acceptance, those acceptance suggestions that you've given is because it is so difficult for sudden hearing loss patients to, if another part of our body suddenly stopped working, we wouldn't just accept that there wasn't a reason for it, or we
Mm-hmm.
don't know.
Mm-hmm.
Because we would hopefully be able to find out that reason. Not necessarily that there would be a solution,
Yeah.
but we'd at least know the reason why.
Yeah.
And very often we just have no answer for these patients about what has happened.
Mm-hmm.
And that can be incredibly frustrating.
Mm-hmm.
But if a patient can come to some acceptance, then they can start to habituate to some of the other symptoms
Mm-hmm.
that they have, and that can be incredibly important. So, those slides that you shared will be so helpful for those patients who are struggling
Mm-hmm.
with acceptance. In regards to the other symptoms that you also experience, How difficult was it to navigate through those as well as your sudden hearing loss?
Actually, I think in the beginning, it was harder to navigate the hyperacusis than the hearing loss itself. I spent a long time struggling going outside. So I lived in the center of Madrid, right in the middle of the city. It was noisy. I'd open the shutters to our apartment, and it was a main roundabout. It was so noisy. So we'd keep the shutters closed, and I remember just being like, I can't even imagine like going into a cafe or going into a restaurant ever again. At the beginning, it was awful. Everything just felt so noisy. It was painful. So emergency vehicles, for example, like sirens on ambulances, it was painful. Motorbikes, really painful. And the only bit of advice I got was, I think it was one of the ENTs, and he just said you need to just keep trying to go outside as much as possible. And they were right. I didn't have any kind of specific sound therapy or anything like that, but every day I made myself go outside a little bit more, and it was really hard. It was really
Yeah.
difficult in the beginning because it it hurt. The noise was painful, and so I'd go out for a little bit and then I'd come back in, and then the next day a little bit more. And yeah, I'm all for a plan. I'm somebody who likes to plan. So I'd have this plan of, okay, well, tomorrow I'm going to go out for 15 minutes, or the next day will be 17 minutes. It was
Yeah.
strict. And my partner would come out with me sometimes just to kind of help distract me. I remember walking past a cafe at one point and just hearing the sound of the coffee grinders like whirring and thinking, like, there's no way I ever want to go back in a cafe again. But it was quite surprising how quickly your brain can adapt, because I think for me, it took quite a while, but even then, looking back, it was a few weeks. And I went to a cafe with a friend just for one coffee, for a quick coffee. And that was the first thing I did. And then a restaurant with my partner and his sister, we went. I think it was quite a short meal. It's quite a quiet restaurant, but I remember after that thinking, yes, like I was saying earlier, celebrate the small
Yeah.
victories. Like, yes, I've done it. So now I can get back to having coffee. I can get back to going to a restaurant. These normal part of everyday life, the little pleasures. So the hyperacusis was actually more difficult in the hearing loss in the beginning. The tinnitus, I also struggled with in the beginning, mainly for sleeping. So mainly just trying to get to sleep in the beginning. But yeah, again, I think, like you said, Joanna, once you start accepting these things, like quite quickly, I knew that tinnitus was probably going to be here to stay. I didn't like that, obviously. I don't want this tinnitus. But you need to, if I think once I made that acceptance with the hearing loss, with the tinnitus, that's when you can start moving forward. That's when you can start thinking, oh, okay, right, well, how am I going to live with hearing loss? How am I, going to navigate today?
Yeah.
Mm.
How's your dizziness now?
And so I regularly see a neurologist for migraine, so for the vestibular migraine, which has been quite bad at times, on and off over the years. Tomorrow I have Botox treatment,
Wow.
which is to help with migraine, which does help. And I'm
Yeah.
also taking a preventative medication as well. I hate medication, but this is something that has been really life-changing. Seeking this support from a neurologist. The Meniere's disease, I'm touching wood. I've not had vertigo in a long time. I don't take medication for the Meniere's disease. It seems that controlling the migraine is helpful for everything. So it's difficult because where these things overlap, because
Yeah.
symptoms are very similar. But at the moment, I'm doing okay. Touching wood again.
That's amazing news. And such a combination of symptoms that are very common
Yeah.
with sudden hearing loss, but each one itself is such a task.
Mhm.
And so knowing that there, is additional support you can seek either for sort of the overarching,
Mhm.
problem or each individual
Mhm.
issue, and
Mhm.
that you are doing like so well so far, it is really reassuring for patients because it can be, like you said, it's a whole like whack. This suddenly happens, and then all of these other things are just a symptom of what this sudden hearing loss.
Mhm.
And as you said, actually, the sudden hearing loss is the bit that has, I suppose, is there all the time and sort of takes over. But
Mhm.
actually, as you said, these other symptoms were harder to sort of manage at first.
Yeah,
Um, and I
exactly,
suppose as you,
exactly.
yeah, became some more acceptance, and that becomes a little bit easier.
Yeah, and I think actually in the beginning when I was sat in the auditorium and I started spinning, I didn't realize the hearing loss because the vertigo and the tinnitus was the crazy thing that was happening to me. I
Yeah.
didn't, you know, it wasn't as obvious that I'd lost the hearing. So actually, yeah, you're right. Those early days, they were the most difficult things to manage. Whereas the hearing loss is just this thing that I'm living with now.
Yeah. And that is something else that I wanted to emphasize some importance on is that early days with sudden hearing loss. The earlier that you are seen, the better the treatment is. Now, obviously, as you said, Carly, your experience was quite unusual that you spent a week in hospital,
Yeah.
that you wouldn't necessarily experience that in other places and other countries. But the earlier that you are seen for a sudden hearing loss, the more that can be offered to you. So I just want to reiterate that importance that you are sort of learning that those early days are so important.
Yeah, definitely, definitely. It's a big point we raise in our book as well is the importance of
Excellent.
that prompt treatment. And I think it's important to know as well, like people who are going into A&E or asking for that emergency treatment, you might have to fight for it.
Yeah.
It's not easy, and I know it's not, but you might maybe take somebody with you to help you. Especially with the communication and just that confidence as well, because it can be difficult. But that early treatment is really important. And as you said, Joanna, probably you won't need to stay in hospital. I don't think I've actually connected with anyone who's had to stay in hospital for a week like me.
You're
Normally,
one
it's
of a
just
kind.
I'm one of a kind. Normally, it will be steroid tablets.
Yeah, but it is, and like you said, it's that fight as well. It's not a bad thing. It's just that very commonly, sudden hearing loss could also be an ear infection,
Mm.
or it could also be impacted wax. But until somebody has looked in your ear, or until somebody has done a hearing test, that cannot be completely proven. And so that is the best course of treatment to be able to actually have a hearing test done, see an audiology department so they can tell you if it is an ear infection
Mhm.
or if it is a sudden hearing loss. And any audiologist, I'm hopefully confident in saying, would be more than happy to do that hearing test to be able to,
Mhm.
and if they can tell you it's an ear infection or wax rather than a sudden hearing loss, excellent. That's the best
Mhm.
news that we can give you. But if we can catch that sudden hearing loss as early as possible, also we're giving you the best chances and best courses of treatment. So it's
Mhm.
just making sure and I'm so glad that you've put that in your book. That's amazing. It's just having that
Mhm.
awareness, isn't it, of
Yeah.
what to do.
It's that awareness as well, just for everyday, just anybody. And also there's people, like we call them the gatekeepers, the people, the receptionists, the people who work in healthcare, spreading that awareness because it's people don't know about this. It's not widely known that you can suddenly lose your hearing, and prompt treatment is so important. So it's spreading that message as well. Um, yeah, just raising awareness.
Carly, my last question, and I hope you don't mind me asking. And I have seen on ASOS actually, there's a lot of advertisements with jewelry, and actually patients who in their advertisement on ASOS, patients have got hearing aids or cochlear implants. Your jewelry, is it actually part of your cochlear implant, or do you sort of do you like to actually bring attention to it? Is it something that you feel comfortable in that way of doing?
Great question. Okay, so am I allowed to talk about the make of jewelry that I have?
Yeah, yes,
Right,
please.
let me show you. I'm going to take my cochlear implant off
Do
and show
you
you
mind,
show
Carly?
you
Is
what's
that
going
okay?
on. Let me show you what's going on. Right. So one thing. So when you look at social media, sorry, my hearing sounds all funny now. When you look at social media or maybe people's stories, you'll see people with behind the ear processors and a circle. Now, this is what I've got is an off-ear processor, which means that there's nothing behind my ear. Now I could choose whether I wanted this type or the one behind my ear. Because I wear glasses, I chose this one. And also there's not a lot of room behind my little ear. So I just was a bit worried about wearing something. Also, I'm not a hearing aid wearer. Before this, I wasn't. So I'm not used to having anything. So for me, this is perfect. I've got a magnet here. It sticks on. This safety chain, which is from Deaf Metal. Google them, they're amazing. Deaf Metal have got lots of accessories. If you can wear piercings as well, you can do it to your piercing. For me, I've got a cuff. This safety cuff means, I'll show you, when I knock the processor off, it doesn't drop to the floor. Now, this processor is very expensive, so I'm very happy that I've got a safety cuff. And on the front, this is a Rondo 3 Medel processor, and this comes off. Yep.
Oh, amazing.
And it just clips on. And you can buy these covers. They're from the Medel website.
And they do different designs.
They do different designs, so I'm starting to collect the
I
different
love
designs.
it.
And I'm getting some more jewelry soon as well. So this chain is attached to the cuff, but you can get separate ones and different colors and different designs. Yeah, check out Deaf Metal because they're brilliant.
Thank you so much. I just think I love it when I see patients in clinic who, and it's obviously difficult for everybody, but those patients who can really celebrate, like you said, that this isn't defining you, this is, you
Mhm.
know, a part of you, you're still you, this is a part of you. But if you can celebrate it and have some fun with it and, you know, have you decorate it, bring it as part of your, you know, your outfit, your
Mhm.
style. I just love that so much. I
Uh-huh.
just think it's great. And
I love
and it's practical as well.
it's practical as well, and I love it. And do you know what? The first day I got my chain, I live in a tiny little Spanish village, and me and my partner went to pay a bill at the plumber's. Like it's very traditional. And we went in the office, and for the first time I was kind of like I had my hair pinned back and I had everything on display. And the lady who we talked to in the office said, you've got an implant in Spanish. And I said, yeah, it's here. And she showed me under her curly hair, she lifted up and she had a bone anchored hearing aid. And it's the first person I've seen in this area of any kind of hearing device that's not a hearing aid. So we were talking about our different hearing aids and hearing devices, and we connected over that. So it was like so nice that it's starting a conversation. And I want people to come and talk to me and say, what is that? And I can
Yeah.
tell them all about it.
I love it. I just love it. I had to ask you, so thank you so much for answering that. I really appreciate that. Carly, thank you so much for joining us and thank you for your presentation. It was amazing. Just to as a bit of additional information, Hear International would like to announce the 8th International Conference on Hyperacusis and Misophonia will be taking place in Hanover, Germany from the 14th to the 16th of October next year, 2026. This conference has established itself as the foremost global forum for advancing research, clinical practice, and a patient advocacy in the fields of hyperacusis and misophonia. Um, the conference has successfully brought together a diverse multidisciplinary community, including otorhinologists, audiologists, psychiatrists, psychologists, neurologists, occupational therapists, speech and language therapists, hearing aid dispensers, social workers, teachers, neuroscientists, researchers, and other allied professionals involved in parent care and research. So have a look at our website. Further information regarding abstract submissions, registration, and full program will be released soon. So that's helpful and useful for anybody who is interested in the field. It's just so that you're aware that this will be happening next year, and hopefully I will see you there. Again, Carly, thank you so much. Everybody, where can they can reach you on the slides that you showed at the end? Where are you sort of most? What's your best platform, would you say?
Good question. Maybe go to my coaching website, which is www.carlysygrove.com.
And we can purchase your book from the 1st of July.
Yes, you can.
Excellent. Perfect. Thank you so much, everyone. Good evening. Perfect. Carly, thank you so much. I really appreciate